when a person experiences persistent or long-term pain in a part of their body, it's very common that when they push their body, whether that's an exercise, like even physical therapy exercises or like working in the yard or cleaning house, that when they push their bodies in that way, it can often result in a flare-up or an exacerbation. This is what I like to call waking the bear.
The Chronic Illness Therapist podcast is meant to be a place where people with chronic illnesses can come to feel heard, seen, and safe while listening to mental health therapists and other medical professionals talk about the realities of treating difficult conditions. This might be a new concept for you, one in which you never have to worry about someone inferring that it's all in your head. We dive deep into the human side of treating complex medical conditions and help you find professionals that leave you feeling hopeful for the future. I hope you love what you learn here, and please consider leaving a review or sharing this podcast with someone you love. This podcast is meant for educational purposes only. For specific questions related to your unique circumstances, please contact a licensed medical professional in your state of residence. Jason is a holistic physical therapist and health coach who specializes in treating individuals with chronic and complex pain conditions. He earned his doctorate of physical therapy and is a certified therapeutic pain specialist and certified health and well-being coach. Jason has a passion for understanding and treating pain, as he has seen the devastating effects of persistent pain on his patients and loved ones alike. His approach to helping those living with persistent pain is multidimensional and incorporates education, coaching, and psychologically informed practices. I can absolutely attest for Jason's work as a physical therapist and as just a really amazing coach along your journey. If you live with chronic pain, because I meet with Jason almost every single month in my consult group that I host for therapists, physical therapists, occupational therapists. It's a multidisciplinary group, and I get to know practitioners all around the country and sometimes the world. Jason truly does empower his patients with knowledge and strategies and tools to more independently manage and reduce their pain while also restoring function and quality to their lives. He has spoken at pain conferences, he facilitates workshops and classes, and he also enjoys being in nature, meditation, soccer, yoga, and music. I hope you enjoy the conversation that we have today. Who are you? Who do you work with? And why do you love doing what you're doing right now?
Okay, who am I? I'm Jason, and yeah, so I'm a physical therapist. That's where my training starts in the professional world. But over the years, I've added other facets to the way I work with people, like coaching practices and self-care practices, psychologically informed practices. So I like to focus on the treatment of folks who experience chronic pain. That's been my specialty or my focus clinically for the past, I guess, 8 years now. Um,
Wow.
yeah, I found the possibility of helping people with chronic pain in new ways really fascinating. I was turned on to a couple of thinkers and teachers in the area of pain science and mind-body medicine. And there's something in that really sparked a lot of interest for me. I've always been interested in the nervous system, and that's a big part, and I'm sure we'll get into that. I also have always enjoyed helping people who are enduring a great deal of suffering, and that suffering is causing them their ability to engage in life to be very limited. So, in other words, I've never been the kind of PT who's inclined to work with someone who recently sprained their ankle, and then that can be really hard for that person. But I've always been more inclined to helping people who've been struggling with a long-term condition that is really in need of some kind of foothold or reason for hope that this can get better for them to
Yeah.
improve their quality of life.
Yeah. So I'm curious when you, even just to think back, maybe how you used to practice and how you practice now, what that evolution has been like.
Yeah. So For the first 4 years that I spent out of physical therapy school, I was working in skilled nursing. And I worked with a lot of patients who experience pain often for many years and on lots of places of their body. But my main role in that setting was to help restore mobility and safety and function so that people can get back home or be able to maximize whatever their functional mobility is. Um, when I left that setting and moved into the outpatient orthopedic setting, I wasn't there for very long and before I realized that I was just not well equipped to work with people who have chronic pain.
Mm.
I was rolling out a lot of the things I did learn, things that I learned in school, things that I picked up along the way, things that the other professionals I worked with recommended, and
So does
it
that mean,
helped.
can I ask, does that mean you were getting a lot of patients with chronic pain and you were just constantly feeling like you were falling short and helping them? And so then you decided to get better,
Yeah.
like better training, basically.
Yeah, it was actually it kind of fell in my lap. It's really kind of weird how it all ended up. My initial goal when I went into the outpatient setting was to work with individuals who had different neurological conditions, things like movement disorders like Parkinson's disease, or had endured things like strokes, maybe even brain injuries or spinal cord injuries. I've always been interested in the nervous system. Um, but I can't remember who recommended it, but someone just recommended that I watch this one video, and this is where it all started for me. It was and some people might be familiar with this name. His name is Lorimer Moseley. He's kind of a pain science physiotherapy rock star. He's kind of well known across the world for that for that reason. And I remember watching this TED talk he was given, and it just opened my mind in so many ways to understanding pain differently and what we can do for it. And from there, the interest just continued to build. And I quickly moved away from wanting to work with neurologic conditions, and I still have an interest in that, to wanting to work almost exclusively with chronic pain or chronic pain and chronic illness.
Was it that mind body piece for you?
The mind body piece kind of came in a little bit later, interestingly. So it started a little bit more nuts and bolts-y, if that makes sense. It was more about trying to affect the nervous system and trying to change things in that way. But it didn't take long before, once you start down that path, you start realizing the impact of things like stress and the emotion centers and excuse me. It what can I start over on that one?
Yeah, yeah.
Okay. Um, so you were asking about the mind body piece.
Yeah, that's kind of where, like, what grasped your interest? You know, you watched Lorimer Mosley's video, and he was talking about the nervous system,
Mhm.
right? What happened next for you? Like, what was sparked next for you?
Yeah, so it didn't take long. Once you start down the path of learning about pain and how it works from a fresh, modern scientific perspective, first you realize that our whole human experience is housed in the nervous system. And once you go down that path a bit, you start realizing that there's a lot of things that coexist with chronic pain, like chronic stress and individuals who experience chronic pain can often experience other things like anxiety and depression. And um, again, once you start learning more about these pieces, you start getting more and more of appreciation for how a person's psychology can affect their physiology and how it affects their body and what they feel. Uh, and then through some personal experience, I started realizing the stronger and stronger connection between the mind and the body. And that once that part opened up for me, all sorts of new interests came in, like things like mindfulness meditation and learning how to uh, reduce stress in new ways through different kind of self-care practices and psychological approaches.
Yeah, that makes sense. Are you
So you did have a personal experience or like, yeah, personal
Yeah.
experience with this that kind of connected
Hmm.
your
Yeah.
passion for it.
Yeah. Indirectly. So there's a person in my life with whom I'm very close who has experienced pain for a long time, and it's taken this person out of their career. They went down the path of the more conventional route, more conventional methodologies for treating pain, like medication and injections, and a more standard traditional physical therapy approach, multiple physical therapy approaches, massage therapy, and it really wasn't making the difference. It helped some, but it was rarely ever lasting. And when this person that I'm close with tried to get back to doing things, it would almost always result in more pain and flaring it up. And then I've met some really interesting people along the way, and one of those people is a physician who practices in the mind body spirit of treatment and looking at how things like emotion and personality and things that have happened to us even in our past and how that can affect or even set up a person for developing more lasting or persistent issues with things like pain. And yeah, from that point, yeah, like I said, I was already pretty interested, and then I got super interested from that point because this was potentially an avenue for helping this person I care about.
Yeah, I love that. Obvious, like it makes sense when we have like a personal lived experience, but I love when there's a connected, like you've seen someone you love go through something and that sparked a passion for what you're doing.
Right.
So what does your practice look like with either patients? Because I know you have your own practice now, right?
Yeah,
And so you have you have do you have clients in your private practice now?
I do.
So does your work look different there with them than it does at your clinic? And if so, what's the difference?
Yeah, that's a good question. I have a couple of clients right now through my private business called Insight PT and Coaching. And these clients are coaching clients, is how the interaction is framed and the nature of our work together. But coaching is something I've been integrating into my clinical approach at the pain clinic where I'm currently working. I've been doing that for a long time anyways. So there's a little bit more freedom because instead of integrating in the coaching into different sort of physical therapy treatments, um, a lot of time it's just spent on that coaching element, which coaching is one part of it. There's also a lot of education involved. There are certain practices that are taught in that space. And again, I do a little bit of that already wherever I'm at, wherever I'm working. But I definitely feel like I have a lot more freedom to go into these issues, particularly on the education side of it and helping people not just intellectually understand the nature of what they're enduring, but also on a personal level, how um, different things in there's all these different contributing factors to a person's experience, including how well they sleep at night, their diet. But the areas that I like to focus on the most are the impacts of stress, and not just stress, but also one's relationship with their body and their symptoms and their health condition that they have picked up over the years. So once they start realizing more clearly on a personal level and develop the insight of how they resist or their relationship to their pain will then affect their pain, then I think it creates a lot more possibilities for improvement for them. So yeah,
Are you
that's a little different.
using, yeah, that makes sense. You're educating about the relationship
Right.
piece to one's body, probably touching a lot on fear and
Yeah.
um do you still incorporate any movement with your coaching clients?
A little bit.
Yeah.
So far, the clients that I have worked with, have been previous physical therapy patients.
Okay.
So a lot of them already have those tools. They know which ones to use more or less. So I might need to refresh their memory a little bit on which ones to use and how. But most of the work, and if a person decides to opt for the more coaching, the coaching path, it's more about becoming more consistent in applying those things and integrating those practices, whether that be movement or self-care practices or stress reduction practices, or however you want to frame that,
Yeah.
in a way that will set them up for more autonomy over their condition or whatever their challenge is, um, and hopefully more quality of life and vitality as a result.
Yeah. Yeah, you're individualizing it.
Mhm.
What what are some of your favorite things to educate clients on?
Yeah,
Mhm.
there's a lot. So I'll share a couple with you, a couple major topics that come up very early in the process. The one that is kind of the most fun to talk about is the bear. And the bear represents a metaphor that I've been using for many years. Um, the idea is when a person who experiences persistent pain, whether that's pain all the time or pain in an area, it's intermittent, but they've had it for a long time. So like, let's say it's back pain. It's not every day, but it's maybe a couple times a week, or maybe they'll have it for a few weeks at a time and then it subsides and comes back later. But anyways, when a person experiences persistent or long-term pain in a part of their body, it's very common that when they push their body, whether that's an exercise, like even physical therapy exercises or general exercise, or with exertional activities like working in the yard or cleaning house, that when they push their bodies in that way, it can often result in a flare-up or an exacerbation. And when the pain flares up, this is what I like to call waking the bear. And from the very beginning, a lot of people who are referred to see me have been hurting for a long time and have had physical therapy before, and it did flare up their pain, not always, but often. So there's already a degree of fear and hesitation about movement and about getting started. So I like to tell them that that's not our priority to start with. That the first project or the first path down which we need to travel is what can we do to calm the bear? Or what can we do to help better reduce your symptoms? And then that's where other conversations open up. But step one, you might say, is to calm the bear down. But then that's probably not going to be enough for them to get back to doing the things they care about. And for that, we will need to challenge the body, build up some strength, endurance, flexibility, coordination, balance as appropriate. Uh, but to do that and to challenge the body, we might have to poke the bear a little bit. We just don't want to wake them up. So that's my silly way of trying to explain having a more partnership strategy with their body. So being a body partner or being more responsive to their body. So for example, if they're trying to build endurance, we might start with a walking program. Most of the things that people who are have been limited by pain want to get back to doing will require some degree of walking. So we might start with a walking program. And in that walking program, it's okay to push into a little pain, but not to the point where you're paying for it and you're feeling worse the remainder of that day or the next day. So that's what I mean by poking the bear. Um, but it's not uncommon for a person who experiences persistent pain to have been pushing through it for long durations of time. Just simply because they've got things to do in their life, they have to work, they got families to take care of, or they just don't want to be held back by what's happening in their body. So they'll push through, and then that just causes the bear to wake up more quickly and get louder. And you can play with that metaphor all you want. So that route over time has a shelf life and doesn't work to help maintain the activities that you care about. But it also, you can't just avoid, right? And that means not just stopping things because they hurt either. So this poke the bear, don't wake them up model is learning how to slowly wade into those activities again, and learn to be a good friend and partner to your body along the way. So that's one of the bigger educational topics, but there are some others.
No, that makes sense. It like really beautifully encapsulates the pain fear avoidance cycle and flaring up faster,
Mhm.
right? So for people who are like pushing through,
Right.
yeah, that goes into the kind of neural signals that are saying, hey, like last time you waited until like 5 hours into cleaning your whole house top to bottom, like we waited 5 hours to tell you you're in pain.
Mhm.
You pushed all the way through that. And so now we're going to tell you in 4 hours, like it's
Yeah.
time to sit down.
Yeah.
And then 3 hours and 2 hours. And this is how we get to a state of inactivity. Or again, just like you keep pushing through, but you're hurting like 10 minutes into an exercise or an activity rather than 5 hours later.
Exactly. And a couple points about that that I think are worthy of addressing. One is, but there are some things where it's just worth it. I like to use the example of, let's say you get invited to a wedding and it's that niece that you care so much about, and you're going to wear those shoes, and you know which ones I'm talking about. And when that song comes on, you're going to be cutting a rug like you're 20 years younger. And even at the time, likely that you're going to pay for it, but probably wouldn't do anything different. And that is understandable. And I feel like it's important to really, honor that autonomy, honor their agency in pushing in those moments. But I would say it's the majority of occasions when it's just not helpful, and it doesn't help them maintain what it is that they care about for the medium to long term. Um, so there's that part. And there was one more part about that I wanted to share, but it escapes me. So I apologize.
No, that's okay. Yeah, I talk about that too with people. Like when people talk about um just this fear that they're going to miss out on everything in their lives. Like, no, you can go on that vacation. You can go for an important hike or the wedding, right?
Mm,
And dancing. But then there's the recovery time after is one part of it. One part of it is like it's just worth it. Like it's
right.
just worth it to do certain things that are meaningful to you. But you're right. Like don't do that every single day while you're doing the dishes. Don't do that every single day while you're doing something at work. Like we're
Yeah.
trying to figure out, you know, how you can navigate that on your day-to-days. And then eventually over time, hoping too that you can get back to the things you love without pain. But for right now, this is where we're at. And while we're learning how to poke the bear, not wake it up,
Mm,
we have to play this little game with ourselves.
yeah. Yeah. It came back to me what I wanted to share about that, and I think you just touched on it really nicely. So before I try to be too prescriptive as to how to enact this bear strategy, or this bear approach to things, I think it's more important that we realize why you're up to what you're up to. So what's underneath this urge to push through? So one just kind of pet peeve, one of many what we might get into, that you see in our healthcare system, including with my field, my profession of physical therapy, is the presumption that people who experience persistent pain um, have either low pain tolerance or aren't being honest about what they're feeling, and that uh, they just they ought to just push harder. And that's not the majority of people, but it's definitely a lot of that out there. A lot of PTs thinking that way, and I strongly disagree, to put it lightly. Um, I think that is totally misguided. There's the majority of people that I work with, like I said, have made it a way of being, or a way of operating in the world, to push through challenging experiences like pain over and over again. Um, and underneath that, and this
Without
is
the resource, without support, right?
right,
I think
yeah,
that's a piece too. Like, and sorry to cut you off, but
sure,
I think like what we're to push through over and over and over again. When you just said that, what came to mind is like someone just breaking eventually under all this pressure. It's like how hard you work day in and day out to push through this experience, and you do it every day until one day you just can't anymore and you like break and crumble. But when you have supports around you, whether it's emotional, physical, just whatever is supportive to you, and that's something that I'm sure you figure out with your clients. I figure that out with my clients too. When the supports are there, you can push through it without it debilitating you.
Hmm. Yeah. Yeah. So I agree. I agree. And I think that external support piece is so incredibly valuable, but so often missing, whether that's on a personal, social level or a professional level with healthcare providers or, yeah, it's often not there. So, so much of what I do is about empowering people to not go it alone, but to have the resource for themselves, to be more supportive of themselves. So on this notion of pushing through, one thing that I've come to realize about that, or what seems true and is validated in the conversations I have with patients, is there's a lot of fear underneath that pushing through. And it's like, well, wait a minute, the idea that I was once given, or was at least the way I interpreted it, is that fear and pain is like there's the fear avoidance cycle is about people who avoid things that hurt, but that's not been the experience for me. It's been the other way around. People continue to hurt and are push through, but what are they afraid of? Well, they're afraid that if they were to stop doing what they're doing, that it can be a slippery slope to not being able to do anything. That if they give in to their pain, that they won't be able to do the things they care about or need to do in life. So there's a deep-seated fear underneath that. And I try to help folks recognize that first by just noticing their habits with breath holding and tension, particularly when they're doing something. So going back to the walking example, it's very often the case that when the bear starts getting poked, let's say you're having back pain after you walk for 3 to 5 minutes, that they'll start to speed up. And that's because there's a part of them underneath, maybe unconsciously or semi-consciously, that is desperately looking for a place to sit down. So there's this undercurrent of fear. And instead of telling a person, okay, just stop pushing through so often or stop, flaring up the pain, it's like, let's get to know where that urge or motivation is coming from and what that represents about a part of you inside. And once we do that, then that opens a lot of other uh, pathways for personal understanding. And I think it's from that personal understanding that the person can then make the choice for themselves. So are they going to continue status quo, or might they try to do things a little differently with that deeper understanding of themselves and why they do what they do?
Yeah. Yeah. That's a good example of you start hurting, so you speed up more.
Yeah. And hold your breath and start to
Yeah.
get tense.
Yes.
Yeah.
And when I think about the pain fear avoidance cycle, which I don't think I've done a whole episode on that, but the pain fear avoidance cycle in the literature has a lot of cognitive component, pain catastrophizing, and like it kind of puts a lot of the fault on the individual.
Hmm.
But the way that I conceptualize it, and this is what I want to do, and I'm sure I would love to hear your thoughts on this because I know we think a lot alike in this way. I use a strong attachment component in it. So
Hmm.
so like when you in that example of the person walking, what they're fearful of is what you just explained, right? Either like not being able to, they're going to miss out on what their family's doing, right? They have to like keep walking. So, but they're fearful of also slowing down. What will happen if I slow down? And so they avoid the slowdown. That's what we're trying to, right? Rather than, I think a lot of pain fear avoidance cycles are like, oh, you're avoiding walking and we just got to get you walking again. And it's like, we got to get you walking again, but we got to get you walking slower and more intentionally or faster. If you're like, it depends on your body, right? What we're doing.
Right.
So I just see it through more of like the emotion. What emotion are you avoiding? And then that leads to some of the avoidance behaviors that are actually going to help you reduce your pain.
Yeah, I totally agree. And those realizations about themselves, I think, are really, it can be really revealing and interesting, and beneficial to them. So yeah, I'm glad we're talking about this, because this is kind of, I think, the centerpiece of what I do now, is to help folks realize their relationship to their experience, to the pain that they're having. And on the surface, the most like tangible or palpable feeling is resistance and anger and fear, that, I've got this pain coming up and it's slowing me down. I'm just going to ignore it, or try to tune out and disconnect from my body, or focus on other things, or I don't want to miss out. And then you hear people talk about it like, my back is angry with me, or my neck is killing me. So you hear this dynamic that's occurring already. It's like right there, about this very tense and friction laden relationship with their body. But underneath that, this is the part that is more theory, but seems to be true, is that the thing that they're most, or not most afraid of per se, but the thing about the pain that might be the most threatening to their system is the vulnerability that comes with it. So their bodies feel vulnerable. And that's makes a lot of sense if you have like a fresh injury. I mean, if you break your leg, that's a vulnerable body part on a real physical level. And when there's persistent pain, it can feel like there's persistent damage and injury, and which is rare. We can talk about that if you're interested. But what's more interesting to me is that the pain that they experience in their body evokes a feeling of vulnerability and fear, and they as a result of that, develop a again non-accepting, resistant attitude towards that body part and towards the pain. And to go deeper, not only is it true that they resist the vulnerability related to the pain, it's often the case, not always, that the people that I work with of or resist feeling vulnerable in all ways. And this is where we start talking about attachment and trauma and personality, and how these are all um, in many ways connected and tied. That if you if your relationship with pain is fear, it's not uncommon that there's a fear in relationship to emotional pain and emotional vulnerability that you might have been carrying for a long time. So I can give you some more examples about that, but I just
Yeah,
wanted to illustrate that for a moment.
yeah, please do. Feel free to go deeper into that.
Okay. So like I said, I try to, I don't start with these topics, but they're just informed in what I do. So I first want them to understand that their relationship with their pain will affect their pain. Um, and that pain relationship for anybody, most people, if not everyone, is at least on some level resistant. It's like, I don't want to be in pain right now. I'm getting some dental work done. This is very uncomfortable. It's very unpleasant. And that's totally normal. It's when pain becomes more persistent that that resistance can become more and more substantial, or contributory. It can affect the experience of pain more and more. So um, if your relationship with your pain will affect your pain, then resistance to the pain will make it worse. And the reason why, and I can use experiential examples and scientific ones. So you might notice that when your pain level is worse, that you hold your breath more and your body's more tense. And I'll use another metaphor, the fist. If you walk around making a fist all day, how's your hand going to feel? And not going to feel good. It's going to feel tired. It's going to feel weak. It's going to feel tight, and it's likely going to hurt. Now, just imagine that your body was making a fist around those body parts that hurt, which is what tends to be the case. And I can give some evidence for that from the research, but just through working with people and teaching them how to relax these parts of their body, they can feel the difference. They can feel more often than not, a decrease in pain intensity, which again reveals to them that there's a lot of resistance towards this experience that they're having. So
Yeah, because
let's
I
start
think,
by, yeah.
yeah, like when you first learn to stop bracing, there is an increase in pain almost instantly. And
Mm,
then very quickly, if you stay with that process, very quickly you do notice a reduction. And so I think that and that's where like my lived experience with chronic pain, I
mm,
think helps me so much is because, and a practice around mindfulness, because when that minute little millisecond of a moment happens, I'm aware of it.
right.
And that can be for good or for bad. I mean, I think the heightened awareness to everything that's happening can also cause a lot of issues. But when you learn heightened awareness with relaxation and how to reduce the fear and non-attachment to the outcomes and
Mhm.
all of the things that we are talking about here and on this podcast, yeah, that's like the ticket. It's all of those things have to work together, the mindfulness
Yeah.
and the relaxation, but also the ability to become charged again. You know, we're not
Hmm.
trying to just stay in a relaxed Zen
No,
state. Your job is not to be a monk.
right.
Like monks train their entire lives for that, and that is what they
Yeah.
do from like birth to death. That's not our job, and that's not what we're meant to do. We're not supposed to stay calm all the time. So yeah, it's finding that balance.
Yeah. And you said something a moment ago that really stuck out, and that's about, again, going back to the fear part, and how fear has such a significant role to play in our nervous system and the things we feel. I like to remind people it's called the nervous system for a reason. Uh, it's not exactly why it's called the nervous system, but it runs on fear is what I tell people. And I think it gets a chuckle, but it kind of makes sense, is that it's more dialed up in a protective way when there's more fear or threat perceived in the environment. But to go back to how to work with that, I mentioned this relationship piece. And when you're talking about relationships, you're talking about more than one person usually. So this is where the language that I use might resonate with some and not others. And I think about things, and I've come to accept things in heart's language, and that makes a whole lot of sense to me, and it's very useful. So let's say you've got back pain, and you really don't want to be in back pain. You don't want to have back pain, and there's resistance and fear and anger in relationship to it. And it could be directly towards the body part, or it could be the failed surgeries or the bad treatments or the lack of care that you've gotten over the years. But there's a lot of a feeling, a lot of resistance wrapped up in the relationship to that body part. So I would help a person notice, I would try to help them feel that emotion arising in their system, in their body. And I invite them to consider that that is a part of them that's really upset about the pain, really doesn't want it to be here, wants to resist it. And there's nothing wrong with that. This is a protective part of you. This is a part of you that's trying to protect you from the pain, embrace against it, keep it from getting worse, or maybe go to war with it. So it's like a loyal warrior in that way. And for some, just making that recognition that there's a part of them inside that really doesn't want to be in pain all the time and is resisting it very strongly. Um, and this is where it might sound a little weird for some, talking to that part. Um, we talk to ourselves all the time. That's what we call thinking. Uh, you tell me who the audience is. If you are having a thought, then you have to be talking to yourself. So I invite folks to talk to themselves on purpose. Okay, there's a part of me, and it's showing up right in here, that's really angry about this pain. And just let it know that you see it. It's like, hey, I understand why you're feeling this way, and I'm here with you. And I'm really sorry you're having that big feeling right now, and that the pain is, giving you so much, is activating you so much, or whatever you want to say. And I might make some recommendations on how to start that conversation. Usually to acknowledge it, to support it, and show a commitment to getting to know it. Um, and then,
I like that last piece, because the
yeah,
commitment to getting to know it, because most
yeah,
people, when they hear this as like a quick tip, you know, it's like, it sounds like, okay, great. I told my pain it's okay. What now? And it's
right.
it's like, No, and it's not about placating. It's about
No.
soothing. It's literally you're soothing yourself, which again, this goes back into kind of attachment issues. But if you weren't taught how to soothe yourself, and if when you were in pain as a
Hmm.
kid, or you know, even like if you're older now, like in the first 20 years of your career, you had a terrible work environment. Like you could have had a great childhood, but that work environment can also affect your attachment to your body, to yourself. So I just think that's always important to say, because we therapists love to talk about the childhood, but sometimes it's like the second 20 years of your life can be just as impactful. So
Yeah,
um yeah, if you were always told like, okay, we don't have time for this, come on, let's move on, like, okay, great, like then you're going to talk to yourself the same way. And
exactly.
now we have to try to rewire that.
Yeah, so I might have a slightly different word to describe that getting to know you. And I think about it as attending and not resolving. It's more about just getting to know it, and from a mindful perspective, learning to have an acceptance that there's a part of me that's really freaking angry about this pain all the time. Um, and what's interesting, and there's so many paradoxes in life, and one of those is that the more accepting we are of different things that we notice inside of ourselves or in the world around us, the less impact those things tend to have. So, for example, and this is one of the cooler parts of this work that I do, and I call it coming home work, and I can explain why I call it that. But when they recognize that, okay, they're having back pain, and the back pain is about yay big. So if they were to map it out, it has size, it has shape, it has color, or sometimes it has color, not always. It has temperature, usually feels hotter or colder, hard, soft, all these things. And then so you get the sensation, the direct experience, and then you have the relationship to it. And that relationship is, like I said, often resistant and frustrated, or sometimes angry or rageful. But underneath that is a lot of fear and threat associated with the pain. So just temporarily not focusing on the pain, I'm not asking people to say, hey, I accept that the pain is here. That's, I think, a little too much to ask. I would say, accept that there's a part of you that really doesn't want the pain to be here. Don't resist the resistance. Accept the part of you that is really freaking angry about this. So once they do that and they tell it, hey, I understand why you're feeling this way and why you're threatened by this pain. Um, and I'm really sorry about that. So maybe offering up some sympathy or compassion. And again, that commitment to wanting to get to know it. The paradox is just doing that can, not always, but have a immediate effect on the amount of pain that they're experiencing, which illustrates a couple things. Illustrates how emotions factor into their pain experience, but also their bodies tend to relax a little bit when they accept the resistance that's arising. And then after they do that part, the real juicy part that comes next is bringing the attention back to the body part and learning to how to be kind to it, because your back didn't choose to hurt, your head didn't choose to hurt. And I know people's like, well, of course it didn't choose to hurt, but at the same time we still ascribe blame and fault in the body part for the feeling or experience that we're having, even though we know that the experience, it does not reside in the brain, but it comes from the brain. So our experience comes from our brain. um, so the body part, I believe, deserves kindness and compassion. But I don't start with that. Again, I want to be clear. I mean, we want to reduce the resistance. That would be the nice target. But first, the paradox is by accepting that there's resistance, the resistance starts to subside a bit because we're validating that fear and frustration underneath our experience with the pain.
Yeah,
So,
that's exactly right. That's how it works. It's how it works. I feel like yeah, like just compassion alone, I mean, can make such a huge difference. Um but even still there can be a lot of resistance to that, because again,
yeah.
like as a kid or in a really terrible job you had, if there was any amount of compassion, it would be followed by danger, like
Mm.
someone yelling at you, or like, or compassion just wasn't even there to begin with, like it wasn't allowed at all, and so you just have no marker for that.
Yeah.
But yeah, it's such a different experience when you allow for that resistance, allow for the anger, allow for the frustration. I think that's a big misconception about this work, is like anything around mindfulness or anything like that, is that you're supposed to learn how to be calm.
Hmm. Yeah.
And then that's what makes the pain go away.
Right.
And because you can't learn to be calm, you have failed yet again another program. And it's like, no, you're not failing. That's
Right.
not something we're supposed to be even.
Yeah. That's very common. I would totally agree. It is very common for folks to get that message, and even when it comes from a mindfulness-based practitioner, um, in my opinion, if you really follow the roots of mindfulness and where it comes from, it the things that are called mindfulness often don't really represent those roots. So what I mean by that is, mindfulness isn't a relaxation practice. It can lead to relaxation, but it's more about clarity and insight and being fully aware of and present for the unfolding of your moment to moment experience, including the things that you wish were not the way they were, that you resist. And that includes your relationship with your body. That includes the challenges you might be having in other places. Um, Again, it's a paradox. I like to sometimes call it the parasympathetic paradox. Most people who experience chronic pain have maybe worked with health professionals and have learned about their sympathetic nervous system, their fight or flight response.
Yeah.
And there are many very well-intentioned healthcare providers out there who want to try to, in kind of a Western mindset, uh, nudge the system out of that sympathetic response into the parasympathetic. And they do that in a variety of ways. Breathing techniques are probably the most common. Now, I'll be honest, I mean, I use breathing techniques a lot, but it's just one part of the treatment. But the reason why I call it the parasympathetic paradox is when you try to force your system to be more calm and relaxed, there's an underlying message that I believe your system is hearing, and that is things are not okay right now. I need to calm down. Things are not okay right now. I need to calm down. That this experience should not be this way. I need to relax. So it might force the system temporarily into a more relaxed state by deepening the breath or extending your exhale, but it still doesn't create the sense of safety with their experience when it isn't the way they desire. And the paradox is by learning to be with what's here as it is and focus on the breath without trying to change the breath, which is where mindfulness of breathing would come in, or mindfulness of bodily sensation, then without trying to change things, they start to change the most. And I think that's an interesting phenomenon that most people are never occurred to them. It's never been explained to them. So that's how I incorporate things like meditation, is to really emphasize that point. There's a time for calming and there's a time for relaxing, and that's going to be really important in this process. But I think for the lasting changes that you desire, or that most people desire, is to really build more mindfulness with what their experience is, more non-resistance and more awareness of their inner experience. And we used the word earlier, lots of compassion. But you can't start with compassion.
Yeah.
You got to realize first, or you don't have to. I mean, it's important to realize that there's a part of you that isn't so compassionate towards you or towards your body.
Yes.
And then can you have compassion for that part?
Yeah.
The part of you that doesn't want the pain or doesn't think you're doing good enough or that you aren't good enough. Can you have compassion for the critic inside or the judgmental parts of you? And then start to care for these more vulnerable, hurt parts that might show up as as a result of that inner exploration.
Yeah, I am working with someone right now, not a therapy client, otherwise I wouldn't be talking about their story, but this is a coaching client that is helping me basically build out like a program. And she was so surprised. I guess I said something like, compassion is not the end goal. It's just a
Mm,
tool that we use to get us to the end goal. And so she wrote me a follow-up later that week and she was like, I don't understand, like, what's the end goal then? If it's not to be compassionate. And it's like the end goal is whatever you want your life to look like. And compassion
Hmm.
is a tool that helps us get there.
I was curious to know what your answer was to, well, what is the end goal?
Well, that
Um,
was it, really.
yeah,
The
it's
end goal is
whatever.
like, yeah, whatever you want. Like,
Yeah, I think that's true. I think that's where the coaching part is so important. And I think one of my many soapboxy kind of takes on things is every healthcare professional should be a better coach. And
yes.
that's not a cheerleader. That's
No.
a person who will ask the right questions, give the right feedback, give the right knowledge, and reflections to help the person in front of them move in the direction that they already desire and utilize the tools and strengths that they already have and do so in a way that will set them up for long-term success a little bit, meeting a person where they're at, so to speak. Um,
And I we talk a lot on this podcast about like how broken the healthcare system is, and it is, but there's still room for open-ended questions
yeah.
in your 15-minute appointments.
Hmm.
They're really that open-ended question that you might ask a patient. Yes, they might ramble a little bit, but like your listening skills get better and better the more you practice
Hmm.
this. And you don't have to be so frustrated with a client rambling. You can just take that rambling, paraphrase it real quick, and get to the answer that you need to get to.
Right.
It's practice, but if you go into this field to help people, well, I would hope you're committing yourself to practices that help you help your patients better. So,
Yeah.
yeah,
Yeah. Yeah.
open-ended questions. Yeah.
I think you are the one who's told me first about the research on the efficacy of treatment being almost, well, not entirely, but largely based off the relationship with the clinician and how important that is. And above the treatment itself, what
Yep.
is the relationship? What is the dynamic? So I'm, paraphrasing a little. And what you're describing sounds, I think at the very minimum, people just want to be heard. People want to be seen. They want to be understood in their suffering. And that is so missing from our system. And in and of itself can have a healing effect, literally a healing effect on their health condition, not just their mental well-being, although that's supremely important, but literally their physical symptoms and health. So I think that's a great starting point. And then to go a little further, just asking these questions and sharing these reflections back to the person so that they know that they're being heard and they can hear themselves and what they're saying. So I think, yeah, that seems like a minimum ask. I don't think it's too much to ask there. Um, there's one other thing that I wanted to share about compassion. I forget. It'll come back to me, I'm sure.
No worries. I was curious to hear more because we got off topic, but coming homework, do you have
Yeah,
like more specific exercises that you like to give people, or is that more of just a framework? Tell me more about how you explain coming homework to patients, clients.
sure. Yeah, it's one of my favorite things to do with people, and it's kind of just an umbrella term for a few different types of practices or different types of exercises, you might say, um, that kind of have a central theme. And the central theme is the expression that we've all heard that home is where the heart is. And I think that phrase is we almost always think of it as figuratively true, but I think it's also literally true. So figuratively, home is the place where or home is where the heart is, would imply it's the place where we feel love, where we feel loved and loving, where we feel safe, where we feel connected, where we feel um, peaceful or at ease. But literally, where is your heart? It's in your body. So home is where the heart is. Perhaps your body can also be home, or maybe it is your true home and has always been. It's the thing you entered the planet with and the thing you'll leave the planet with, if that's how you think about it. But the idea is coming home to your body in a variety of different ways. So in a real general sense, learning how to find that safety, peace, love, ease in your own body. But the reason why it's called coming home work is because, well, and for many reasons, and we can get into them, we become disconnected from our bodies in a real general sense. I mean, this a general commentary that most people would relate to is that we're very much up in our heads a lot of the time, thinking about the past, the future, and fantasy land in between. Uh, we can be very mentally preoccupied very often. And when we're not mentally preoccupied, one of the other components of our constructed experience, to play with our friend Tyler's terminology, is the external senses that uh, we can very much be preoccupied with what's going on around us, what we're watching on the television, what's on our devices, a lot of device stuff, which then feeds back into thinking. But then there's this other thing that fills up our experience, and that is our sensations, our bodily sensations. But that's where it would seem that a large percentage of the people that I work with chronic pain and chronic illness have become more disconnected from is the physical sensations of their body. So coming home work is about coming back to the body in a general sense in that way. But to go further, this is where the part stuff that I was mentioning before comes in. It's like, okay, well, why have you become disconnected from your body? Well, that's where you hurt. So why would you spend time focusing on your body when that's the thing that hurts all the time? Or when you do focus on your body, it's only when the pain is elevated. So there's more resistance in those moments. And mental reactivity. And I'm not going to put labels on that like many others would, but there's a part of you, I would say, that's really scared and frustrated and upset about what's happening in your body and how it's affected you for all this time and how it might continue to affect you and kind of surgeries and procedures you might need, or that vision of your retirement or your future is now not possible. It doesn't feel possible. So there's all this resistance. And I would say coming home work also means connecting with these parts of oneself through the physical sensations in their body, like I was mentioning before. So let's say that there's a part of you that's really anxious about the back pain. So if you stand for any longer, it's going to flare up and wake the bear. It's like, well, there's a part of you that's really scared that's showing up right now. And you might feel that maybe in your throat or your chest or your belly. And then I would just ask the person to say those three things, those three offerings. I see you. I'm sorry you're feeling this way, and I'd like to get to know you more. I'm going to come back and check on you. And just talk to that part of yourself that's really getting activated in that moment. And just doing that can go a very long way to reduce some of the nervousness in the nervous system, help calm it down a little bit. And then do
Yeah.
that same kind of thing for the body parts that hurt or have illness attached to them.
Right. Yeah. And again, just to reiterate, like the goal is not to be calm, it's just to give a little bit of relief to this really overactive part that is trying to protect you in a
Mhm.
moment where you may or may not need to be protecting that hard.
Right. Yeah. But it's understandable why it would. And that's the thing that it just needs to hear. And the reason why I'm very careful about that, I know I've kind of said it a couple times, we're not, we're just trying to attend. And I know that you appreciate that, but just in case the listeners aren't, understanding what I mean by that, is like a lot of times the way these parts of ourselves operate are not necessarily present moment oriented, and they're not thinking through things logically necessarily. And I'm not saying that's always true, but
No, and that's not an insult. It's like literally
yeah.
your emotion center is heightened,
Hmm.
and our emotions can be an amazing guide,
Yes.
but we also don't attune to them either until they're in this heightened state and they're yelling.
Correct. Correct. Exactly. So we just want to honor that part of you is scared for a good reason, even if it's maybe not the most rational or reasonable or evidence-based reason. I mean, I'm not a big fan of trying to talk people into thinking things differently. I invite them to, I present my take or the take that I've adopted from other smarter, wiser people or thinkers. And then I invite them to consider that and kind of evaluate it internally. Does it feel true? Does it make sense? I mean, we even say it, does it make sense? Well, why would we say make sense with something that is conceptual? And that's because there's a feeling. It's like, that feels right to me. And then to also just look at their life experience, their lived experience, and see if, hey, yeah, I have noticed that when I'm more stressed, I hurt more. Or when I start poking the bear, I start holding my breath. So there's some fear coming up, some anticipation. So I just try to help folks notice what they're up to first. And I like to say it that way because sometimes, well, I wouldn't say sometimes, I would think most of the time, the parts that are involved in our reactivity and the feeling of vulnerability that comes with pain tend to be young parts. Now, that's maybe a very radical take on this for some. To me, it makes perfect sense. It aligns with a lot of the things that I've come to believe from the worlds of internal family systems, attachment theory, which informs that as well, and this other newer thing to me called interrelationship focusing. That's very often the case that these reactive parts that are highly resistant and scared, they don't think like an adult. You can't reason with them. They didn't get that care oftentimes when they were young to just experience their emotions in the state that they're in. And that's what you can provide to them now. So coming homework, just to kind of put that back in here, in many ways is like a reparenting process. And reparenting the parts of you that show up in reaction to the health circumstance and the symptoms you're having.
Yeah, that's exactly right. Yeah, there's a lot of reparenting stuff here. And yeah, I'm also sometimes careful with like labeling processes that I use, and because I recently learned about reparenting work from the world of Al-Anon. I don't know. I think I'm trying to remember. And so then it's actually the coaching client I was working with was kind of educating me on this, and I didn't know where the origins came from. So it's just funny how different things mean different things to different people.
Yeah.
But I guess her understanding of it felt very much like reparenting. She had this take of like, it's all my job now to reparent myself. And I think that is how it's presented in a lot of ways. Like, no one else is going to do it for you. You have to do it for yourself, which, okay, kind of, yes, but we have to seek out models that we can learn from in that way.
Right. Yeah.
And so it's
It's a good,
hard. It's hard because you can't just teach yourself something you've never seen.
you never got. Yeah, for
Yeah.
sure. Now, just one, note here. I totally agree, and I don't want to give anyone that impression. What just seems to be true, and I mentioned this earlier, is a lot of the people that I work with, particularly at the pain clinic, they just don't have the external support, uh, whether that be family, friends, community, church. Some of that's there, but it's very superficial, or some ways it's actually part of the problem that they might be
Yeah.
having. Um, so to me, the reparenting concept is intended for empowerment, but not to burden the person with, hey, you got to do it all yourself. And to be fair though, in the one area that I feel like, and I don't know, I use this often, and I hope I'm not misstepping here. If I use the example, if there's a little kid that ran in the room right now, and that little kid was really scared and sad, maybe their parent left them there, and they they don't know how to get back home. They don't know their address, they don't know their phone number, and not even sure if their parent left them there on purpose. I'm pretty sure, and I'll say this, I'll tell the patient or client I'm working with, pretty sure you're not going to send that kid out into the hallway and say, hey, calm down. And then when you're done, you can come back in and we'll work on this. Like, that's not what happens. There's an immediate sense of compassion and sympathy for this child and a desire to want to protect and help. And then I just make the point that, okay, you've already got the format. You've already got it. Because I know you're not the kind of person who would send that kid out and not help them or her. And then the goal, or part of the goal, part of the project maybe, is to learn how to turn that inwardly, slowly at a little bit at a time. But you're right in saying that it's very unfamiliar turning it inward because they never got that. That was, or not always, but that's one of the unmet needs they perhaps had, is someone who can lovingly attend to their feelings in emotional states without trying to tell them they should feel differently, or yeah, invalidate their feelings for in some way.
Yeah, I think the slowly part is really important too, because it takes your brain, it takes my brain, and especially after having kids, my brain doesn't do, not work quite the same way anymore. But and I'm laughing, but it's actually very true. Like my processing speed when somebody is talking to me, I have to pause what I'm doing, look them in the eye, and sometimes ask them to repeat themselves.
Right.
I have heard what they said, but I really do need to slow down and do that whole process to fully understand what was just said to me.
Mm.
And if I'm stressed or tired or hungry, that takes longer.
Yeah,
I have to slow down even more. So I think that's the other part of this, is everyone is racing to some finish line. And right now there's all these pain programs, which love that for the people that it has helped. But I'm finding there's also just a lot of people who feel like, oh, great, I failed one more thing.
exactly.
It's like, well, yeah, you were doing it alone through
Yeah,
an app where you just saw other names, but there's no real community there. And you were also racing to a finish line. And I'm saying that as like a, you were doing this. It's not actually about blaming them. It's like, that's just how our society runs. And so you're doing the same
exactly.
thing that you've been taught to do. And a lot of this is actually, yeah, slowing down.
Yeah, in its own way, it is still kind of a find it, fix it kind of mentality, instead of honoring the person and where they're at, and maybe how they got to the place that they're at, with compassion and acceptance. Um, so yeah, I know you and I talked about this kind of Western mindset of, trying to find and fix, and in some of these more psychologically informed, neuroscience informed approaches to treating pain. It is still better than what we had before, which was nothing. But it's in some ways, I mean, one of the things I do say sometimes is that one of the worst things about these approaches, some of these more race to the finish line approaches that you're describing, with a program or a book or a combination of that and maybe some therapy, is that it does work some of the time. I think that we as clinicians can be blinded by our biases, and seeing that when it works for some, that the reason why it's not working for others is that it's their problem, that they're not getting it, they're not accepting it, they're not doing their homework enough. And I think perhaps they might be missing that there's something else that might be getting them the results that they're looking, that they believe are coming from the approach. So I'm trying to be careful not to step on toes of some specific ones that you and I have talked about. But one other thing, though, and this goes back to I remember what I was going to say earlier, is about goals. One of my favorite concepts from the mindfulness world, you could say, is the path is the goal. And that idea, I think, is very true. And you talked about the race to the finish line is totally understandable and desirable, but it's each step. The goal is each step. And that can be really frustrating and really unpleasant to hear. But it's also the path that leads to the lasting changes that most people desire, at least from my experience.
Yeah, I agree with all of that.
Um, yeah,
It turns into a little bit of a spiritual conversation, which
it
I would
does.
be careful about, but I don't know. I mean, yeah, I guess when you live with chronic pain enough, or when work in this, it's not just chronic pain, but like when you work in this field, or when you see problems that can't be fixed, I think all you have left to do is think about something that's bigger than you, the universe, whatever your spirituality looks like for you.
Yeah,
Yeah, I just think, because how else are you gonna
yeah.
cope? That's my take on it.
Yeah, the spiritual dimension to this is extremely important, but also highly delicate because there's so many different perspectives and opinions. Um, so I think the things that I'm talking about don't have to be spiritual. They don't have to have a religion or mysticism to them. But I do think that there is something quasi-spiritual about learning how to become more aware of what your inner experience is like and be guided by your own instincts and intuitions, which you might say are quote unquote God-given. You know, these are things that you're equipped with to help. You know, I make the joke a lot of times that there's a lot of books that I would like to write. Whether or not anyone reads them is another story. But the one
Same.
book that if I wrote one book, just one, the book would be called "The Body Brings You Home." And that's how I view so much of what I do. And for some that might be a confusing title, and for some that might even be a little off-putting. But the idea is um, that some of the pain that a person, maybe going back to that, some of the pain that they're experiencing um, might have something to do with a part of themselves that's been trying to get their attention for a very long time, in that it needs attending and care, but for very understandable reasons, largely to do with of how a person's raised and the culture in which they grow up and the way they've been treated over their life. They've learned to unconsciously mostly ignore or avoid. Um, so when they start to realize these inner dynamics at play, again, it is a step in a long journey, but they start to realize that the path towards coming home to themselves and to their body is to learn to make these to have these realizations about what's happening inside of themselves. And yeah, I don't think of that as spiritual necessarily, but I do think it has a really powerful effect to it.
I think you're right. I don't think it is inherently spiritual, but for some reason, every time I have this conversation, there is something inside of me that goes, this is spiritual. Like, I think neuroscience explains it all. I think our Western techniques explain it all, but, and yes, this is just this is like my own thing now. This is
Sure.
not something I think everyone should think, but that's what happens for me. Every time we have this conversation is like, and then I didn't grow up spiritual. Like I grew up as secular as anyone else in this country, who's not religious. And so maybe that's part of it. Maybe that's, I don't know, but it always feels like when we start, maybe it's just this sense of awe and
Hmm.
wonder
Yeah.
that happens for me when we have this conversation. Like my brain just starts going and going and thinking about how many different moving parts there are.
Hmm.
Billions, right? If you think about all the neuro activity that
Hmm.
is happening in our bodies, and yeah, I just start seeing like, I don't know, like galaxies in front of me, and it just feels super spiritual.
Well, that's cool. I like that. I like that experience. Yeah, I think there's two words that come up very often that have a very religious connection, but I think don't have to be. And one is grace. I think graciousness and having grace for oneself. One of my many little sayings, I call them my dumb Jasonisms, is shame leads to more of the same, but grace leads to growth. And I
Yeah,
think that's so true because we put so much should and ought on ourselves to do different or better. And that tends to lead to more of the same because either the change isn't lasting or we we get more stressed as a result of all that pressure. But the
I think
grace,
that's it.
mhm,
That's it. The
yeah,
stress makes it harder to achieve what it is.
absolutely.
Yeah.
But if we can have grace, which I think of as an understanding that's kind, clear, compassionate, benevolent, maybe, I think that will lead to longer term changes. It's a more fertile soil for that growth to occur. And then the other word, to go back to what you're saying, is faith. And faith not in a higher power per se, although that is super important for many, in that, or faith in some kind of specific belief, but more of it's kind of like a trusting without the knowledge. So it's kind of like going back to that walking the path. That you don't know exactly where the path will go. And as much as you try to control, you can't know what will come next. You can have faith in yourself, not in yourself like alone, but that you have wisdom inside. You have insight. You have the ability to get to know yourself and to make healthier and healthier choices for how you, healthier is probably the wrong word, wholesome choices and skillful choices for how to walk that path. And that's where I think some degree of faith comes in. You can't know it all, and you can't necessarily be in front of everything. And in doing so just creates more fear and stress and resistance anyways.
Yeah. Yeah, there was a time where I was really getting into a lot of the neuroscience and reading everything I could about how the brain works, how the nervous system works, how the body works. And the more I knew, yes, there was a lot of insight that came along with that. Like, oh,
Mm.
wow, this makes sense and that makes sense. And I love learning. I still occasionally, but now when I open a book like that, I intentionally label it as this is for entertainment, not for learning. And that's because as soon
Like,
as I start to try to like absorb it all, remember it all, it just feels like, and the more you read too, you start to read opposing ideas that
yeah.
have just as much like research behind it or just as much wisdom behind it too. And then you're like, wait, so which one's right? Because they're opposing ideas. And you're like, that's again where it starts to get spiritual for me. I'm like, this is too, I'm not religious. I didn't grow up religious, but um it's just in the Christian faith, it's like the Bible says that you won't like know everything until you get to heaven.
Hmm.
And so again, even though that's not my religion, that concept really sits with me. I'm like, okay, we think we know so much, but like we really don't.
Yeah. Yeah.
And so there has to be some trust in what and not I like how you said it earlier. I can't remember exactly, but it was I think that was the key piece is like without the knowledge, all you have is trust or don't trust because the knowledge is what helps you like know something.
Mhm.
And if the knowledge isn't there, or if there's all this knowledge out there, but none of it, like it doesn't all agree with each other, then you don't actually know.
Right.
That uncertainty piece is really hard, but
Oh yeah. Yeah. It makes you think of Alan Watts's book, The Wisdom of Uncertainty. I'm sorry, Insecurity, The Wisdom of Insecurity, which has a
oh,
lot to do with that same idea. Um, which I won't
I have
try to
to read that.
paraphrase him. He was a brilliant man. But anyways, I totally resonate with what you're saying. There's a reason, a very intentional reason why I named my business Insight PT and Coaching. Insight can have lots of meaning to it. I'm going to paraphrase the like standard textbook definition as something like a deep understanding of a thing or of a person or a thing or something like that. Insight has also a lot of other meanings that I would relate to it. So yes, so on that note, understanding can be knowledge. It can be, knowing something about your pain that you didn't know before that can be really useful. That tension makes it worse, so relaxing might make it better, or that your pain has been attributed largely to some age-related changes in that structure, in that body part. But a lot of people have that same situation in their joints and don't hurt. It doesn't mean that your MRI is irrelevant. It's just not the whole picture. So knowledge can go a long way. It can open doors. It's kind of like these little, pointers like, hey, look over here, or maybe don't look over there so much, or something like that. So knowledge, I think, is important. Insight also, though, means awareness. I think that's a different kind of understanding, awareness of yourself, of your inner nature, of what's going on, the different layers and dimensions to your experience. So that kind of knowing or understanding. And insight's also associated with wisdom. And wisdom and knowledge are very different. In my opinion, wisdom is something that isn't acquired with, more intellectual concepts or understanding. It's more of the truth of things, what feels wholesome, what is aligned with my values. Is this serving me or is it not serving me? Um, what is my next best step here? Learning how to listen to that inner wisdom or those instincts. I think all that goes back to insight. So again, back to just your point about it, knowledge can go a long way. It's never enough. There's no knowledge in the world that you can acquire that will make you feel safe and help create the resolution you desire, I don't think.
No, I love that. I love that so much. I love the word insight, and I love all the meaning that you put into it for yourself and naming your practice that. I love that. Yeah,
Yeah.
it's true. It really is about, it's the journey of figuring yourself out.
Hmm.
What lights you up, what darkens you. And you're
Hmm.
right. Like yeah, you explained that perfectly, because usually on a lot of these pain science podcasts, they'll bring up the bulging discs, and how, you have two MRIs, one shows both show bulging discs, one person has pain, one person doesn't. Another MRI, no bulging discs, one person has pain, one person doesn't. And so they're basically saying, like, the bulging disc doesn't cause the pain, it's your brain that causes the pain, blah, blah, blah. I get that. There's legitimacy to that. But again, it's not that your MRI doesn't matter, or that you're like, oh, see, like, you're fine, or it's your fault for feeling pain when you have a bulging disc, but this person over here with the bulging disc doesn't have pain. No, there's so much more to the puzzle. And some of it might be within our control, like our stress management. But even within stress management, there's a lot that isn't within our control.
Oh, that's very true.
Like, you can't control what your industry standard is for pay rate. Like, if you have a certain skill and a certain job, and that's all you can do, mostly what you can do, then you can't control what you get paid.
Yeah.
Entrepreneurs will tell you differently. I'm an entrepreneur. I love the pursuit of excellence and doing more, but I'm very aware that that is a privilege that I have. That's not a choice that I made, some rags to riches story that I did all on my own. Like, no, there's a lot of privilege that comes with that. So,
I agree. Yeah.
yeah.
Yeah, I'm glad you made that point about the pain science approach, which I don't want to label it so broadly because so much of what I do and what I believe and what I know and what's been helpful is pain science. And I still teach people about how pain works, and I use other metaphors like the alarm metaphor, and I can explain that if you're interested. But the point is, you can tell people and try to explain things in the best ways, and maybe, to be fair, maybe I haven't tried hard enough, or I haven't tested the learning of my patients over time to see if they were really hearing and understanding the science I was sharing with them about their bulging discs, or about the role of the nervous system, or how sleep affects things, or inflammation, or whatever. Yeah, maybe I just didn't do a good enough job at teaching in that way. But I don't think that's the case. I think that until the experiential awareness or learning occurs, it's not just again, it can help a lot of people, but when it doesn't help, it doesn't mean that either A, the person is unwilling to be open to the perspective, or B, that you just need to keep hammering it in. Maybe there's something deeper experientially that will help them know that there's a truth there without explaining it. So, for example, if someone comes in and they tell me that their back is hurting, and because of everything they've been told by everyone else except for me, was like, well, what does this guy know? It's like everyone else told me it's a disc problem, or it's a arthritis issue. And then I have them go through maybe a breathing exercise or a loosening practice where I teach them how to relax their body, and their symptom experience, first person, changes. If it gets better or changes at all, what didn't change was their disc. What didn't change is that it became less arthritic. There's something that just happened and it had nothing to do with those structural explanations. So it's more about just opening their awareness to the multitude of contributing factors, and also helping them focus in on the areas where they do have the most agency. I know we got into some of I call it the cart issues, putting the cart before the horse, like these heavier issues about your relationship to your body and stress and emotions and attachment and trauma. All that matters deeply, but it's not always the best place to start. So, I mean, sometimes it's just a simple breathing technique to help them see, hey, I hold my breath all the time. And I tend to do it when I'm hurting or I anticipate hurting more. Or when I'm more tense and guarded, I'm hurt more, or when I'm more relaxed, I hurt less, or I sleep better. Just those recognitions, that's way more valuable than teaching them about pain or having them read a book about it. So I totally resonate with you on that. And then if they can apply that, I think that's where the wisdom part comes in. When they can apply that awareness and learning going forward, well, one of the other cheesy Jasonisms that I like to share is I want to teach people how to fire me. I want to teach people how to not need me anymore. It's like once they start realizing that they have more uh, potential for impacting their experience than they were ever told, um, yeah, then the goal would be for them to not need me as much over time.
Yeah, exactly. And same here. But I will say my percept my conceptualization of that is so much different now than it used to be. I used to feel like, okay, I'm doing a good job as a therapist if like we reach these goals and you don't need me anymore. But
Mhm.
the more and more I do relational work and attachment work, it's actually like, okay, we might not need weekly anymore. And my goal is to go from weekly to biweekly to monthly to quarterly. And it's not linear like that. And then some people will be with me weekly for a year. Some people will be with me weekly for 6 weeks. And it
Yeah.
just depends on like what you need support wise. And if you're getting that in your life elsewhere, then you don't need to come see me. If you're not getting that, that's okay. If I am the person providing you with that and you're getting
Yes.
other things outside of here, um,
That's
eventually.
fair.
Yeah. Yeah.
Yeah, yeah, I think that's a good point. I don't want to mislead and too much there because I think you're 100% right. There are some patients who I've been working with for many years. But yeah, it's more to illustrate the point that, you don't need to come in. I nor anyone else can fix you because you
Yeah.
don't need fixing, first of all. But second of all, the the healing comes from within, not from the outside. So you perhaps won't need me as much over time. That's definitely true. And I do like to see folks maybe more often at the beginning and then less often over time, maybe once a month or even less than that,
Yeah.
so that they can have that place to turn to, if they have any new challenges or want to progress or explore something new.
Because yeah, new challenges will come
Yeah,
up, right?
totally.
And you might have done a phenomenal job when they were working with you consistently. But you might be also the only one in their life who like talks about things in this way. And so they just might need a little refresher.
True.
And that is very human and necessary. So yeah, I always want to make that really clear
That's
to
true.
clients. But
Yeah, I'm glad you said that. And it was a good recognition for me to hear that. So thanks.
yeah, of course. What else comes to mind? This feels like a good ending spot, but I'm wondering if there's anything that you want to leave people with or that we didn't touch on that you would like to touch on.
Yeah. I feel like our conversation it meandered in kind of some fun and interesting ways and unexpected ways, and I enjoyed that. Yeah, I think if there were just maybe a couple things that I hope folks will either take from this or would be interested in exploring more, is that pain is complicated. If we're just going to stay with that one, that's like my, main topic anyways. Pain is very complicated. Uh, there are a lot of things that contribute to it. It's never just one thing. I like to use the silly example. If you stub your toe and your dog died and your truck broke down and all the bad things that happen in a country music song, that toe pain is going to feel one way, and the healing will even be affected by those other factors. But if you stub the same toe and you never had before, it's the same exact injury, and you just won the lottery and you had a wonderful evening with your wife the night before, or your husband, and everything's going well, it's going to be a different experience. And anyways, that's just a silly way of saying that your experience is going to be affected by lots of things: sleep, diet, stress, patterns of tension, connection with your body, and stress is kind of just stuck it in there like it was on this equal footing. I mean, hopefully at this point, it's no mystery that that is the single greatest part of this picture is the impact of stress and emotions, in my opinion. But it's not the
Yeah.
only thing.
Just as long as we always have that caveat that stress is not you're always something. It's not always within your control.
Oh no.
Oh,
Yeah,
yeah.
totally. Yeah,
Yeah.
it's not to say that it is a target for change, but it is a target for understanding. Like there's this piece here, and it's let's get curious about this and let's get to know it, what's going on here, that and how it's affecting things, with some desire or some steps in place to reduce, but to more understand. And I think that can go a long way just in and of itself, that when you see pain in a gray lens and not a black or white lens, I think for most people that can be very empowering and help them see that there's more that they can do about their circumstance than they had previously been told. So that's one of the main things. I do think um, your relationship to your experience is supremely important. And that's weird language for many, particularly if they have no experience with something like meditation or mindfulness. But it isn't too hard to acquire anyways, or otherwise. I'll take people through practices with no experience with meditation, and they'll see fairly quickly that there's a difference between the sensation that they're having and the relationship to the sensation or the experience. And once they start seeing that relationship, that's, I think, a very important starting point to ultimately, I mean, if you were to put a goal up there on the horizon, it's can we have a more of a partnership with our bodies and have a relationship that is more supportive and respectful, and treat the body with compassion and dignity and all the things that you would, again, can you come home? Can we move in a direction where you feel more at home, at peace, safety, ease in your body again? Okay, that's the target. Now, like any relationship in life, you can try to start fresh. You can try to start with a blank slate, but that ain't gonna work. You have to kind of know where is this relationship now? What are the layers and dynamics that are already here? And that just getting curious about those things, I think, can lead people in a really fruitful direction for long-term positive change.
I love that. Yeah. Thank you so much for sharing all that. And
Yeah,
your people can find you through your website,
yeah,
insightempowers.com,
yeah,
and they can work with you one-on-one virtually. And then you
yes,
also have a YouTube channel. Yeah.
yeah, I do. Yeah, so feel free to check out the website, insightempowers.com. Um, there are links to some videos I've made, educational videos, breathing exercises, meditation. And if a person's, interested in working with me, they can reach out to me through the website, or they can just email me at jason@insightempowers.com. Um, and if we just need to start with a short consultation to describe to explain what that working relationship might look like, I'd be happy to provide that for free. And then we'll go from there. I also have a class that if folks are interested in, it meets every Friday at lunch at 12 Eastern time. And it's called the Caring for Pain class. And it incorporates There's three main components to it. One is a practice of some kind. Usually it's a breathing based, well, there's a little bit of breathing and a little bit of mindful awareness of the body. And I might throw a few layers of this coming home work in, just getting to know the pain and the relationship to it and that sort of thing. But just, just to perk someone's curiosity. Uh, then there's the group discussion part, which I think is really important and interesting for people to be able to share what their experience is and kind of hear from each other and feel supported and seen with other people who experience something similar. And then there's the education piece, which I tend to wrap the session up with some kind of takeaway or insight that people can apply in their lives. And yeah, you don't, it's a drop-in style class where you can just show up anytime. So those are just a few things for folks to explore if they're interested.
I love that. And that's all on your website. So I'll link that in the show notes. Thank you so much for this conversation. It was exactly what I expected. I know we're on the same page with a lot of things. So thank you.
Absolutely. Thank you.
Thanks for listening. If you learned something new today, consider writing it down in your phone notes or journal and make that new neural pathway light up. Better yet, I'd love to hear from you. Send me a DM on Instagram, email me, or leave a voice memo for us to play on the next show. The way you summarize your takeaways can be the perfect little soundbite that someone else might need. And lastly, leaving a review really helps others find this podcast, so please do if you found this episode helpful. And P.S., clicking subscribe ensures you'll be here for the next episode. See you then!